Did you know that syphilis rates have been rising at an alarming rate? In some parts of the world, cases have skyrocketed. This often silent infection poses a serious health risk if left untreated. It's time to confront this issue head-on. Knowledge is power. Understanding syphilis is the first step towards protecting yourself and your loved ones. Syphilis is a sexually transmitted infection. It's caused by a bacterium called Treponema pallidum. This tiny organism wreaks havoc within the body, leading to a range of health problems. Syphilis spreads through direct contact with a syphilis sore. These sores are often found on the genitals, rectum, or mouth. Transmission occurs during vaginal, anal, or oral sex. Syphilis can also be passed from mother to child during pregnancy. This is known as congenital syphilis. It can have serious consequences for the baby. It's a stark reminder that syphilis isn't just a personal health issue, but a family one too. Syphilis is a complex infection. It progresses through different stages. Each stage has its own unique set of symptoms. Understanding these stages is crucial. It helps us appreciate the importance of early detection and treatment. The first stage, primary syphilis, is marked by the appearance of sores. These sores are called chancres. The second stage, secondary syphilis, often involves a rash and other systemic symptoms. If left untreated, syphilis can progress to a latent stage, where it hides silently in the body. The final stage, tertiary syphilis, can affect various organs, including the heart, brain, and nervous system. The first sign of syphilis is often a painless sore. This initial sore is a critical indicator that the infection has taken hold in the body. It's important to recognize this early sign to seek timely medical intervention. This sore, known as a chancre, typically appears at the site of infection. Chancres are the body's first response to the invading bacteria, and they mark the beginning of the primary stage of syphilis. This could be the genitals, rectum, or mouth. These areas are the most common sites where the bacteria enter the body, making them the primary locations for chancres to develop. Chancres are usually firm, round, and painless. Their painless nature often leads individuals to overlook them, thinking they are harmless. They can easily go unnoticed. This is particularly concerning because the infection can spread without the person being aware of it. This is especially true if they occur inside the body. Internal chancres can be hidden in places like the vagina, anus, or mouth, making them even harder to detect without a thorough medical examination. Despite being painless, chancres are highly contagious. The bacteria can easily spread through direct contact with the sore during sexual activity. They are a clear indication that the body is infected with syphilis. Recognizing and diagnosing syphilis at this stage is crucial for effective treatment. Even if a chancre heals on its own, it doesn't mean the infection is gone. The bacteria remain in the body and can progress to more severe stages if left untreated. Without treatment, syphilis will continue to progress to its later stages. These stages can cause serious health issues, including damage to the heart, brain, and other organs. Early detection and treatment are crucial to prevent long-term health complications. If you suspect you have been exposed to syphilis or notice any unusual sores, seek medical advice immediately. Timely intervention can prevent the disease from advancing and ensure better health outcomes. Section 5. The waiting game, latent syphilis. After the initial sore heals, syphilis enters a latent stage. This stage is particularly insidious because it often goes unnoticed. The bacteria, Treponema pallidum, continue to live in the body, but they do so quietly without causing any immediate symptoms that might alert the infected person. This stage is often silent. People may feel perfectly healthy and go about their daily lives without any indication that they are still infected. This deceptive calm can be dangerous because it lulls individuals into a false sense of security. There may be no noticeable symptoms, no rashes, no sores, nothing that would typically prompt someone to seek medical attention. This is why regular health checkups and screenings are so crucial, especially for those who have had unprotected sex or multiple partners. However, the infection remains active within the body. The bacteria are not dormant. They are merely biding their time, waiting for an opportunity to cause more severe damage. This is why syphilis is often referred to as the great imitator, because it can mimic other diseases and conditions. This silent threat can last for years. The latent stage can persist for a long time, during which the bacteria continue to multiply and spread throughout the body. This prolonged period of inactivity can be misleading, making it seem as though the infection has resolved on its own. In some cases, it can last for decades. The longer the bacteria remain in the body, the more damage they can potentially cause. This is why it's essential to understand the nature of latent syphilis and the risks it poses. During this time, the bacteria are multiplying and spreading. They can invade various organs and tissues, causing damage that may not become apparent until much later. This makes the latent stage particularly dangerous because the damage is being done silently and invisibly. They can silently damage vital organs. The heart, brain, liver, and other critical organs can be affected, leading to severe health complications down the line. This is why early detection and treatment are so important. This makes early detection and treatment even more critical. Regular screenings and prompt treatment can prevent the bacteria from causing long-term damage. It's important to follow through with medical advice and complete the full course of treatment to ensure the infection is fully eradicated. Latent syphilis can be further classified into early latent and late latent stages. This classification helps healthcare providers determine the best course of action for treatment and management of the infection. Early latent syphilis is defined as infection within the past year. During this period, the infection is still relatively recent, and treatment can be more straightforward and effective. While late latent syphilis refers to infection lasting longer than a year. This stage indicates a more prolonged infection, which may require a more intensive treatment approach to fully address the bacteria's presence in the body. This distinction is important because it helps healthcare providers determine the best course of treatment. Understanding the stage of the infection allows for a more tailored and effective treatment plan, ensuring the best possible outcome for the patient. Section 6. A disease of many faces, secondary syphilis. Weeks or even months after the initial chancre disappears, secondary syphilis can develop. This stage is characterized by a variety of symptoms. These symptoms can affect different parts of the body. One of the most common symptoms of secondary syphilis is a rash. This rash can appear anywhere on the body, including the palms of the hands and soles of the feet. Unlike other rashes, the syphilis rash is often not itchy. This can make it easy to dismiss as something less serious. Other symptoms of secondary syphilis can include fever, swollen lymph glands, sore throat, muscle aches, and fatigue. Section 7. The final act, tertiary syphilis. If left untreated, syphilis can progress to its most serious stage, tertiary syphilis. This stage can be life-threatening. It can affect various organs in the body. Tertiary syphilis can cause damage to the heart, blood vessels, brain, nervous system, bones, and joints. It can lead to a range of severe health problems including heart disease, stroke, blindness, paralysis, dementia, and death. The symptoms of tertiary syphilis can vary depending on the organs affected. Section 8. Fighting back, treatment and prevention. The good news is that syphilis is curable. With timely and appropriate treatment, individuals can fully recover from this infection. The earlier the infection is detected and treated, the better the outcome. Early detection not only helps in effective treatment but also prevents the spread of the infection to others. Penicillin remains the most effective treatment for all stages of syphilis. This antibiotic has been the cornerstone of syphilis treatment for decades and continues to be highly effective. For people who are allergic to penicillin, alternative antibiotics are available. These alternatives can also effectively treat the infection, though the choice of medication may depend on the stage of syphilis and the patient's overall health. It is important to complete the full course of antibiotics as prescribed by a healthcare provider, even if symptoms disappear. Stopping the medication early can result in the infection not being fully eradicated, leading to potential complications. This helps to ensure that the infection is completely cleared from the body. Adhering to the treatment plan is crucial for a full recovery and to prevent the infection from returning. Prevention is key in the fight against syphilis. By taking proactive steps, individuals can protect themselves and their partners from this infection. Practicing safe sex by using condoms consistently and correctly can significantly reduce the risk of transmission. Condoms act as a barrier that prevents the exchange of bodily fluids, which is how syphilis is typically spread. Regular testing for sexually transmitted infections, including syphilis, is also crucial, especially for individuals who are sexually active with multiple partners. Early detection through regular testing can lead to prompt treatment, reducing the risk of complications and further transmission. Education and awareness about syphilis and other sexually transmitted infections are vital. Understanding the risks, symptoms, and prevention methods can empower individuals to make informed decisions about their sexual health. Community health initiatives and workshops can play a significant role in spreading awareness and providing resources for prevention and treatment. These programs can reach a wide audience and encourage safer practices. Follow-up care is also an important aspect of treatment. Regular checkups with a healthcare provider ensure that the infection has been fully treated and help monitor for any potential recurrence. By staying informed, practicing safe sex, and seeking regular medical care, individuals can effectively manage their sexual health and prevent the spread of syphilis. Section 9, Your Health, Your Priority, Early Detection Saves Lives. Syphilis is a serious infection with potentially devastating consequences. However, it is preventable and treatable, especially when detected early. By understanding the symptoms, stages, and transmission routes of syphilis, we can empower ourselves to make informed decisions about our sexual health. Regular testing, open communication with partners, and prompt medical attention are essential for protecting ourselves and our communities from the silent threat of syphilis. Remember, your health is your priority. Don't hesitate to seek medical advice if you have any concerns.